Everyone had a good break, and I'm so excited for the next two sessions. One is Frances Roy from Ascension is going to be talking about how they engage, and she was just kidding with me. She's like, we don't just do 100,000, we do 160,000. I'm like, oh my gosh. So I don't even know the starting point of how to introduce her. She's the Chief Talent Officer at Ascension Health. She was also SVP, VP of Leadership, Org and Development at HCA. She got her PhD in counseling and org consultation, also teaches at Vanderbilt University. And I was just so impressed when I first met her a little bit over a year ago by the qualities of questions and responses that she was looking for. Because I remember she told me that she wanted, that back then Ebola was a big deal. And she said, I can't ask my nurses and physicians and frontline people if they feel confident they can handle an Ebola outbreak before Tiny Pulse. And so that was one of the inspirations for them to get started. So I'll let her share all the rest, and I'm so excited here now to welcome Frances Roy.
Thank you. Appreciate it. Good morning. So I want to ask you, as we start, how many of you at your present organization or somewhere else have ever done the big employee engagement survey, and the next big one you did after that come back and ask the question, do you feel like significant changes were made as a result of the last survey? Anybody in here? And how many of you just had your associates say, it's amazing how much has happened since that last big survey, right? I know I'm being a little sarcastic, but I think it starts to talk and lead into some of the story that I want to share with you today, which has kind of been our Ascension story and why we've made the changes that we've made and just some of the incredible things that are happening for us with our work with Tiny Pulse. So we're going to start with a little bit about who we are, even though I was joking with David, 160,000 associates all in the U.S., 2,500 sites of care, and so a very large faith-based organization. Although we honor people of all faiths, we care for people of all faiths, and so that's kind of how we look at the faith tradition within Ascension. And one of the things that we started looking at was, what did we want our culture, in a sense, to look like? And how were we going to focus on some of the big changes that we were making within Ascension? So there are a couple of pieces I need to tell you about right here because they really relate to the story. When you see the One Ascension journey, we were federated organization, meaning that every one of our ministries, that's what we call our hospitals, ministries pretty much operated independently and not much was centralized. So within the last 2 years, we've started moving into centralizing our focus, the things that we do, and that means centralizing processes and departments and benefits, all sorts of other kinds of things. And any of you who've gone through centralization know, especially in a large, complex organization, you have the stage where things start to get messy, right? That part of change management where you kind of get to the discomfort, some of the more difficult changes that have to be made, and really wanting to ensure that your associates understand why you're making the changes that you're making. So as we look at pulsing, we wanted to look at measuring several things. Number one, how is our One Ascension journey, the journey to One Ascension going, and how is it impacting our associates in their own line of sight? Did they understand why we were making the changes we were making? And then also to look at our culture, which we call model community. And here you can kind of see in the slide, mission focused and trying to create an environment in which we have capable associates who can flourish. So that's a little bit of the backdrop for where we are now and something that we were really thinking about as we put Tiny Pulse in place. As you start to look at what was our challenge, we wanted to have, and this really came from our senior leadership group, when we went to talk to them about doing our next big survey, they were like, why don't you all look at doing something a little differently, more innovative, more timely, and not these large surveys, which just gave us the opportunity to go out and look at, what was out there in terms of possibilities. We didn't feel like, going back to the comment a minute ago, that the big survey was necessarily having the kind of impact that it should have, and that the large survey was kind of stale and really not using the language that our associates use, more mobile technology, other kinds of things. So we decided that we wanted to look again at doing something totally different. So just so you'll know, as we set the context for this, we haven't done a large survey now since 2013. What did we want to start to look at then? How could we have real-time feedback and data? I love, and heard the panel just a minute ago, talking about Cheers for Peers and the interaction, the interactive components of TINYpulse, which we have really loved. That ability to get information in real time and be able to respond to it, to be able to have a tool that provides a mechanism for two-way dialogue, and at the same time to be able to be more innovative in how we were doing surveying was really kind of what was at the crux of what was behind what we were doing. So again, we're measuring engagement, we're measuring the journey to One Ascension. We're very much a mission and vision values-driven organization, wanted to focus on being able to measure that. One Ascension, again, is our sense of culture. And in the One Ascension piece, I want to put this in now because I don't want to forget this. In this year, starting in January, we started pulsing, okay? And we pulse. We have 160,000 associates. We pulse 140,000 associates every week from January through nearly the end of June. Okay, and I'll talk later about how we move forward. But we wanted to benchmark some of these specific areas, and some of it relating back to where we were in 2013. One of the things I love about TINYpulse is their flexibility to work with you. All of our questions have been custom questions at this point that we've used because we, again, wanted to create some benchmarks. The One Ascension piece, we have an index called the One Ascension Ministry Alignment Index. It's 13 questions about where we are on our journey to kind of centralization, One Ascension. We use Pulse Survey to, again, benchmark where we were this year. 2 years from this last July 1, all of our senior leaders will be measured on the increases in our scores from this year. And so we have a goal, a % increase that we need to get as an overall organization. If we don't hit that number, our senior leaders have the potential of having their compensation impacted by 50%. 50%, right? So we mean what we're saying. It's a stretch goal. But the thing that's most important about it is when we think about what we're doing we call our initiative My Voice, and what we're doing with this initiative is that it needs to be leader-led. We're responsible for it in HR. We put the TINYpulse contract in place. We select the questions. We do all the analytics. You'll meet some of the other people on our team here in a few minutes. We do all of those things through HR. But we felt that it was really important that it not be a push, and that truly it was leader-led out in our ministry markets and our ministries. So that's really the way that we've looked at My Voice from the very beginning. So what's our journey been like since we started? This just gives you an opportunity to look at all the questions we pulsed up until the end of last week. And if I were you, I'd be looking at that saying, is that right? That participation rate is somewhere between 22 and 25%, and the answer is yes. Now, let me explain why. We're very complex, again, in terms of how we're set up, and email for us is a difficult way to communicate with our associates. 1/3 of our associates use email like most of us would. 1/3 use their email on average once a week, and 1/3 of our associates use email not at all. So how do you communicate with 160, 140,000 people? And so what we did was we started just using email. Now, I do want to say 25% of 140,000 is a significant number, right? And so we're statistically significant down to the ministry level. So there's not a problem there. Do we want to increase the participation? The answer to that is yes. And so now we're looking at putting in kiosks, other kinds of things. We encourage our associates to use their apps, but many of you who are in healthcare understand this. You know, our nurses and others who work on the floors aren't allowed to have their phones out, right, while they're at work. And we're not going to require people outside of work to go into an app to fill out a survey question, right? So we just have some dynamics within our organization that make communication with associates a little trickier. And again, we're looking at kiosks and other things that we might put in place. Again, not HR pushing. We're asking our leaders, what do you need to increase your scores? And they're the ones who are now saying this might be something we want to look at to be able to enhance our numbers. But that does not mean, again, that only 25% of our associates have been involved in pulsing. As you can see in this number, 53.4% of our associates have been involved in at least one pulse question. The data that comes in, you can imagine, is unbelievable. Between January and the end of June, like I was talking about, we had 80,000 comments. 6 of us took the 80,000 comments and read every single one of them, okay? And Erica here at Tiny Pulse, who supports us, kind of went through the comments and did the same thing so that we could kind of pull a lot of what were we seeing in terms of patterns and feedback from our associates, which I'll share in a minute. The Cheers for Peers, I can't tell you how much feedback we get from our associates about how much they love Cheers for Peers. So that and the two-way dialogue, again, you know, something that I think is really powerful in that ability to say, we've heard your voice, we're listening to your voice, and then we want to respond to your voice. So what are our associates telling us? And I didn't put this in a slide because you all know how that goes. I'm sure people are taking pictures of slides, and you know, some of our departments might not be very happy if it's, you know, they're showing up somewhere. So I'm going to kind of share what we found as strengths. This is again between January and June 1, but one which is really important for us, I think, in terms of a strength, is the sense of strong affiliation that our associates feel with our mission. And our mission, so that you all know, is to ensure that all persons are cared for, and particular focus on caring for the poor and vulnerable. So very mission focused, very mission based, and it really drives everything that we do. A strong sense of accountability and calling, people truly feeling called to their work, and that being really important to them is another thing that emerged that our associates told us was really powerful for them about working at Ascension. The next piece is that they understand why we're moving to One Ascension, a national ministry. I think this is important. If I had to narrow down what some of our pulsing has told us around this, is they understand why we're centralizing. Anybody who works in healthcare know margins are not as strong as there are. There are all sorts of changes that are going on. There are lots of benefits, I think, in doing the centralization. So they understand why. I think they just don't quite like the hows, right? The changes that you have to make as you're moving towards centralization, and you'll hear some of those in a minute, and some of the things that kind of get identified as other areas. And the other thing was that they felt a strong sense of feeling valued, particularly by their supervisors and the patients. So a true sense of belonging and value. As I move to the areas for opportunities, let me say, they did not feel that the communication from our senior leaders, either in their ministries or in our national ministry, was as strong as it could be. And that we were not communicating enough about the changes we're making, why they're being made, and really paying attention to the impact, maybe, of how some of those changes are being made. So that has become a definite opportunity for us. Another one, when we start to look at opportunities, this was a big one. I'd be interested to know if anybody else has seen this. So we have not asked a question yet about compensation and benefits, okay? We have had huge thousands and thousands of comments about comp and ben, And most of it went back to the question about whether or not they felt valued by the organization. And so they came out of the comments that we read through. And if I had to narrow it down again, I'd say that compensation hasn't moved up, but benefit cost and out-of-pocket deductibles have. So when you start to look at quality of life and financial components, then many times you feel like associates aren't seeing themselves as moving forward. And so I'm, in just a minute, going to talk about one of the things that we're doing actually to address that. But that was another area that came forward as another possibility for us. The third is that we don't do a great job of pushing out national initiatives. And you can imagine, as we have centralized, going back to what Megan said, I think a few minutes ago about the prioritization. Goodness gracious, there are so many national programs that are in place that are being done, many times, of course, getting pushed from system office out to the ministries, and they're like, we are overwhelmed. The amount of work, what we're being asked to do, maybe with fewer resources, becomes very difficult. And sometimes the way you all, meaning us in the system office, roll out those national initiatives are not necessarily paying really good attention to how those may be impacting us and how well we've been communicated with or kind of had input into the decision making. And then the last one has to do with, and this is a resource piece again, many saying that we need to have changes and upgrades made in our ministries. We need more equipment, some of those kind of areas, and that those were things that we needed to focus on and pay attention to as well. So that'll just give you a little background, in a sense, about the strengths and weaknesses from what we heard from January through June. What are some of the lessons we've learned? And again, being such a large organization, our lessons may be a little different than might be for others, but thought it might be helpful to share some of those. So we started in January, all 160,000 or 140,000 that we do all at one time. We didn't do a pilot. We didn't do a test run. We didn't do anything like that. If we were doing it over again, would we potentially look at doing it that way? I think the answer is yes. But the reason for that is more for us is in our data and our linkages in PeopleSoft. The way that we're structured is, it's a whole different discussion, but we have lots of opportunities there. So how you map responses to different managers, directors, areas like that. I think that there were some challenges that we found there, and we've had to spend time and energy kind of focusing on that. Another one would be kind of having spent more time from a change management perspective, communicating to our leaders in our ministries what was going to be required or needed from them as they led this. So all of a sudden, every week, they're getting all of this data specific to their own ministries, right? What do I need to do with it? We heard that feedback from them, so we created a toolkit that we actually sent to all of our leaders to give a frame of reference of how we needed to communicate, some different templates, helping them understand the dashboards better, some of those kinds of things. That we would have more proactively looked at our data, which I told you about a minute ago. Drilling down on the comments. So how do you take all of that information? And I will say TinyPulse is working with us significantly. The word cloud, as you know, is part of the tool, but we needed to kind of drill down more specifically, I think, and look at what some of our opportunities are. So they've helped us look at what are some of the patterns of information that are coming out in the comments. Now, I will say, on the other hand, at each ministry, we want leadership reading every comment, right? So we don't want to give them just the summarized version. For those of you who read the comments, it feels a lot different to see a PowerPoint with a few bullet points on it than to read the actual things your associates say, right? Some of them can be really powerful. And then the last piece here is, and it's ongoing for us, trying to focus on what's that balance between what we do from our centers of expertise, meaning at system office, how do we lead the work versus what needs to happen at a local level in terms of being leader-led. So where are we going? Here are a few things we're doing to respond to what we've heard. So the compensation and benefits information I just shared with you. We're looking, for instance, at nursing, going back in and looking at compensation in every market. And you say, well, don't you all do that anyway? Of course we do market studies, and we have those things, but the thing that's true is our benefits and comp COE makes the recommendations out to the markets, and they determine what they do locally. So some of our markets may have gotten behind the recommendations. So we have senior leadership looking at, we have a huge study that we're finishing up right now where we will have discussions market by market about compensation. We are working again in that balancing piece. Our leaders did ask for some kind of a consistent communication tool to help to be sent to them that they can then customize themselves, but kind of looking at across Ascension, what are some of the patterns that we're seeing. One of the things that for us when we're talking about people feeling overwhelmed and overworked is when you have large numbers of vacancies in different areas, then somebody has to pick up, right, for that which is missing. So really focusing on our time to fill in terms of position, particularly in clinical areas. And then now we're starting to use the My Voice Tiny Pulse feedback, in a sense, really going into the analytics and now taking some of the next steps, looking at the differences between our high and low performing ministries, looking at what some of our strategies need to be, and focusing on very specific populations like nursing and physicians. So let me just say now, we are now moving to pulsing every other week, all associates, and then on the off weeks, pulsing specific populations with specific questions, targeted questions like to nurses and physicians. And I just have to say this, I'm not really just trying to overly plug Tiny Pulse, but yesterday we had a meeting with them yesterday morning, and we said we need to see the slices of data for nurses and physicians differently than we're seeing it. And this morning when I sat down at breakfast, they said, can you come into the other room? We want to show you something. And their team in Saigon had created all of that last night. So I can't wait to share it with our team this morning. But that just kind of shows the kind of customer service, in a sense, that we're talking about, and then focusing on key themes. So the next piece I want to kind of end with before we do questions, and this part still gives me the chills, having worked on this for a year, but how powerful is it to think about, okay, we know how our associates are feeling, how are our patients feeling? And those of you who work in healthcare, we do patient surveys and HCAP scores and those kind of things, but we're always getting that feedback and you're looking backwards, right? What would happen if we could pulse our patients in real time? And guess what? We are. See this little tablet? We have 3 ministry markets right now where we're in alpha testing. I was able to go to one of them in Detroit just recently, and the nurse, this was in a huge emergency room, huge number of visits, came running up to me and said, are you one of those people on the team who brought Tiny Pulse in? And I was like, yeah, and she's like, can I give you a hug? And she threw her arms around my neck, and she was like, I want you to know I love my job. And see, it still gives me chills. And I was like, wow, this is so powerful. But you know why it's so powerful for her and powerful for us? So she goes into the room. The patients are handed the tablet. They can fill it out themselves if they want to, or if they can't read or something is impairing them from being able to fill out the 3 questions that we ask. She asks the question for them and fills it out for them, right? And the amazing thing about this is, she said, not only do I get to understand what our patients are feeling, then I go share it with our doctors and nurses and others who are around here, and we can address the things that those patients are feeling that need improvement in real time. So before that patient ever leaves the emergency department, there is an opportunity to interface and do something about it. So what she was saying is, I came to work in this field because I wanted to make a difference, and guess what? I can go listen to what our patients need, and I can help make sure that difference is made immediately. So what are we going to be doing with this? You all kind of know how this all goes. This information between the associate engagement, patient satisfaction, and linking those two together. So if you went and looked at our dashboards right now in the hospitals where we are, you can tell by hour, by shift, what our patients are experiencing. By floor, right, by shift. Well, how interesting would it be to say, so what are our associates feeling, experiencing? Are they feeling overwhelmed? Where are we getting the best outcomes? So being able to link the two together. And you all know this as well as I do. When you start to look at associate engagement, it can either be that touchy kind of feely things that we should do in organizations, or you can link it to business priorities and outcomes. This work for us is definitely tied to and focused on business priorities and outcomes, like HCAP scores, like turnover, retention, all sorts of other areas where we're going to be able to take our associate data and our patient data, pull it together, and then link it again to clinical outcomes, all sorts of other things that happen at the same point in time. So for me, that is really the exciting place of being able to look at the impact of our associates, what they're feeling and experience on what our patients feel and experience from us when they come to us for care. So that's a little bit about our story. And I think David's going to come up here and we're going to answer questions that you might have related to what our journey has been like. As he does that, I just want to acknowledge that we have other people on our team, and this is definitely a team effort as we do this, and if they can kind of just stand up, because we brought teams so that people could talk to, so Amy and Caroline and Jason and Rob, I know they don't know I'm getting ready to do this, but we're all here for you to answer questions, to talk about what the journey has been like for us. Rob and Jason head up all of our analytics. Amy and Caroline head up the engagement and culture side of our work. So if there's anything that we can share with you that would be beneficial, we're all here to do that. So.
Great. So now we've got about 10 minutes, and we're going to take some Q&A from the audience. And first of all, I think I told some of you guys I got bit by a dog on Thursday before the conference while running on a trail. And I think I needed some patient pulse right there because she gave me great care. All right. So who's got some questions for Francis?
Hi, I'm Harry from Seattle. My question is, it sounds like you have kind of long lead times for what you're going to do with your data. So, because it's such a big organization. So the question is, how do you keep people engaged with TINYpulse or your One Voice in the meantime? Mm-hmm. Do you do a lot of communicating back on small things? How do you keep them kind of letting them know it's out there and you are doing something with it?
So that's happening more at the local level, because really the changes that get made, let's just take something like equipment. It's not going to have much impact if we just say, well, in our Ascension budget, we're going to put this many hundreds of thousands of dollars into the equipment budget. What makes a difference is in a particular ministry, do they have more monitors? Do they ask the associates, what equipment is it that you're needing to be able to do your job more effectively? So that's why we really, where you start to see the impact happening, it's more at the local level. And that engagement, is the way that we're set it up or encouraging them to do it so that there's feedback on each question each week. So, and we have transparency. We share our scores across all ministries to our leaders so they can see where they are in comparison to other ministries. But then again, they would then do whatever needed to be done at a local level to address things, because I think it's more relevant from that kind of a standpoint. Now, there are national things that we're doing, just like this compensation study. When we go back in and it gets communicated back to our associates, we heard you, this was important to you, this is what we found, and these are the actions we're taking. That will be a mix between us from a national level as well as the local leaders as well, kind of communicating that back so that people understand how it fits within the whole framework for Ascension.
So I did have a question around, I know that you said you tied the compensation for senior leaders and it can affect almost 50%. I didn't know it was that high. Did you push that agenda, or was everyone in agreement and they just said, we want to do this Francis, you go find the solution that enables us to do this.
Well, first of all, I'm leaving next year. No, I'm just joking. No, well, the real truth is that it really came from our senior leaders. And so our boss in HR, our executive vice president of HR, and some of our leaders said, you know, if we really mean what we're saying, then we need to tie this, and we call it our long-term at-risk compensation. And each year there's a goal for at-risk, and so in 2018 it is the at-risk goal. We will do a survey in the end of this year, like May or June, on all of those questions together, plus some others, not a big survey again, but asking those 13 questions and potentially some others all at one point in time to see what the movement has been in the first year, so that we'll understand what's going to need to happen within the next year.
Got it. Great.
Yep. Here's one.
Over here.
Robert, also from Seattle. I'm curious, you said you went with all custom questions, and that allowed you to drive benchmarks, your own benchmarks. But with TinyPulse, we're able to benchmark also against other industry. Do you have questions that you're able to benchmark against industry benchmarks, or has that been a challenge for your org?
Well, so when we did this in 2013, the big survey, we already knew which questions we could benchmark against some national components, so we had that in 2013. But you know what? I know people feel differently about benchmarking, but for us, that really isn't, even looking at other industries, it's not a big driver for us. It's like, what do we need to be doing internally? And sometimes when you're benchmarking, I really believe the nuances of different industries, you know, things that are going on, that's just, we don't see that as necessarily being as relevant. And again, sometimes you're looking at older data. So for us, it just wasn't a huge, it didn't, even though TinyPulse offered that, that was not a big driver for us in the selection process, because we really want to be better at getting better against ourselves.
Great. Another question? Okay, well, let's give a big round of, to Francis.
Thank you.